It seems like everything is changing by the minute when it comes down to these vaccines. First they want to give half doses instead of full doses, and then they wanted to just give one shot instead of two. And, at first they wanted to do frontline workers and elderly people, especially in nursing homes. Well, now they are admitting they won't be able to get to all of these nursing homes quick enough. So this is NPR, January 5th, 2021. I'm going to go ahead and play this audio for you.
The last week of December was the deadliest yet for people in nursing homes, with more than 6,400 deaths. More than a third of all COVID-19 deaths are now linked to long-term care. Coronavirus vaccines are reaching more and more facilities, but many worry they won't come soon enough to stave off a lot more deaths. Will Stone reports.
Terry Robertson had no interest in waiting till the second week of January to start vaccinating the residents and staff of the long-term care community he runs north of Seattle.
We got notice from CVS that January 9 was our first date, and I thought, that doesn't work.
So Robertson switched to another pharmacy, one that was able to bring the first doses to Josephine Caring Community much sooner, just a few days after Christmas.
I just pinch me. Am I dreaming? Is the nightmare over? I'm just like, wow, this thing could really be over.
In the late fall, the coronavirus was rampant in this northwest corner of Washington state. Eventually, it got a foothold at Josephine.
We had residents, just had so many test positive, and we're doing everything we can.
By early December, more than 170 people had been infected. Some died. And it's the same story in nursing homes and assisted living communities in dozens of states.
Unfortunately, even though we've been at this for so many months, not that much has changed.
That's Tamara Konecka, a professor who studies long-term care at the University of Chicago. She says the research is clear. Even the best-run nursing homes are not impervious to outbreaks when there's a reservoir of disease in the surrounding city or town.
All along, it's just been delusional that we could have these areas with high community spread and somehow protect long-term care residents. It just doesn't work.
Staff come and go. Some work at multiple places, and residents move in and out too. The vaccine is a key turning point, but Konecka says it's not a magic bullet.
I think it'll dramatically reduce the number of deaths that we see, but will it eliminate the problem? Not yet.
There will need to be multiple rounds of vaccination to deal with the churn of staff and residents. In Pennsylvania and many states, at least half of all COVID deaths are linked to long-term care. Zach Schamberg leads an industry group in the state. He says nursing homes which have struggled to get PPE remain desperate.
Since day one of the pandemic, we have fought for one thing, and that's prioritization. And it's no different now than it was 10 or 11 months ago.
Some of Schamberg's members aren't scheduled to get the vaccine until late January or even early February. Elaine Ryan with AARP says there just hasn't been enough transparency about nursing home outbreaks and now vaccines.
It is an American tragedy. It's a national disaster. It's not that we don't know how. There is a lack of accountability.
Some states, including West Virginia and Connecticut, are doing well with vaccinating. So says Mark Parkinson with the American Healthcare Association.
Every week that the vaccine is delayed in long-term care facilities will mean at least an additional 4,000 to 6,000 deaths. So there's just no excuse for any governor not making this an incredible priority.
But so far, he thinks the U.S. is on track to meet the goal of getting every facility its second dose by March. For NPR News, I'm Will Stone.
Okay. So you heard they may not be able to get on to any of these nursing homes like they said they were going to be able to get to them in the beginning. So as you heard, nursing homes, man, it is really bad. 5,600 deaths just in the last week of December, if you were listening closely. Man, that is terrible. So long-term facility, places that care for the most vulnerable, high-risk populations now account for 40% of all U.S. deaths due to the virus. That's pretty high, you know? And it's awfully funny. In the beginning, ladies and gentlemen, if you remember, they said the elderly population would be the most vulnerable before they conveniently switched to Black people and then never showed us one damn number proving that we got it the most. You know? So go figure. So now 40% of the deaths are the elderly in the country. So meanwhile, the COVID Track Project shows that more than 50,000 new cases are being reported in long-term care each week. That's a lot. 50,000 new cases per week from the nursing homes? That is absolutely crazy. At least a dozen states, about 50% or more, all COVID-19 deaths are among residents and staff of these facilities. And it's going to be even worse because now they're admitting they're not going to be able to get to them, quickly enough. So the situation for the nursing homes will be even worse. So the first phase of the vaccines includes residents and long-term staff facilities, but the speed at which they are receiving the doses varies significantly from state to state. Because of their vulnerable population, nursing homes are generally being prioritized ahead of assisted living facilities. Every week that the vaccine is delayed in long-term care facilities, that will mean at least an additional 4,000 to 6,000 deaths. That's a lot. That is a lot. So, and according to the latest, they said more since the beginning of the pandemic, all the way up until now, more than 100,000 people died from COVID-19 in nursing homes in America. That's a lot of people. That's a lot of people to be gone. And then 50,000 a week are contracting it. That is insane to me. But y'all, please tell me what you think. This is crazy. But, the problem is they rolled out the vaccines and they didn't have any plans in place on how to distribute it to everybody. And plus, there's a nursing shortage in the country on top of all of that. So it's not been a smooth transition. Many of you have been following my videos. You have people that died. You have people that got sick after the vaccine. It's just been horrible from day one. But y'all, please tell me what you think about this story. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace.